The CDC recently released new data about unvaccinated school children. Their report shows nearly 4% of American kindergartners had an exemption for a required vaccine last year. That led to about 138,000 new school children not receiving otherwise mandatory vaccines. For many, that meant they didn't get the DTaP vaccine, which protects from whooping cough. And now, as children head back to school, we're learning about a rise in whooping cough cases across the country. In 2024, more than 6 times as many whooping cough cases were reported compared to the year before. This morning, we welcome former acting CDC director and president of the Robert Wood Johnson Foundation, Dr. Rich Besser. Dr. Besser, thanks so much for being here. We appreciate it.
Great to be here, Brandy.
You know, we've heard that data about fewer children getting vaccines. What impact do you think that's going to have on the healthcare system?
Well, you know, Brandy, there's something incredibly tragic when a child gets a disease that is totally preventable. And that's the situation that we're in right now. Thankfully, most parents make the decision to vaccinate their children fully and on time. In my 30 years of pediatric practice, I spent a lot of time answering parents' questions so that they felt comfortable. But I worry that this school season, we're going to see classrooms, not with 4% of kids not being vaccinated, but with 25, 50%. Because that number where they say that 4% of kids are passing up vaccines doesn't capture what actually happens in the classroom, where you tend to see grouping, where parents talk to each other, and you have situations that are really powder kegs for a virus to arrive and cause problems.
Dr. Besser, I want to be clear, though. Have there been any changes to vaccine requirements for this school year?
No, not from last year. You know, this is done by states, and so it's important to check at your states. One of the things that I worry about is that, you know, in California, to get out of the school vaccine requirement, you have to have a medical condition that makes it dangerous for your child to get vaccinated. In some states, it can be parental choice. Many states, it's a religious preference, but there are very few religious prohibitions to vaccination. But I worry that because there's so much misinformation and disinformation being spread by political leaders, that parents are going to, you know, who want to do the right thing, are going to make the wrong decision. That's why it's so important to talk to your child's doctor.
And there really is a push by physicians like yourself, as well as the Robert Wood Foundation, the Robert Wood Johnson Foundation, to really get the message out. Tell us more about the work that the agency is doing now, especially as all these students are heading back to class.
Yeah, you know, it is so hard for parents to get the right information to make their decisions. There is so much misinformation out there. And so we are trying to be part of the chorus that's saying, you know, do the right thing. Get your questions answered, make the right decision. There are a number of diseases that I saw early in my pediatric practice, types of meningitis, that we just don't see anymore. Measles was declared eliminated from the United States. That's not the case anymore. It's spreading. The whooping cough is a disease that we should not be seeing in our schools like we currently are, and that's on the rise. These diseases are preventable, and when you vaccinate your child, you not only prevent your child from getting sick, you help protect children in the classroom who may have a medical condition that prevents them from getting vaccinated. It's a wonderful thing you can do.
Dr. Besser, we appreciate you joining us this morning. Definitely a lot for parents to know and to consider as they're preparing to send their little ones back to class. Thanks so much.
My pleasure. Thank you.